Hi everyone, welcome back to our channel. I'm Dr. Amel from City Skin Clinic, and today we're going to have a chat about Ozempic face aging. Before I get started, if you're new to this channel, welcome. Please don't forget to subscribe and hit the notification bell. And if you are a returning visitor, welcome back. Thank you so much for all your support. So let's get started. The reason I did this video is actually Ozempic face or Ozempic face aging has been getting quite a bit of press, and I'll expect that we'll hear a lot more about it over the coming months and years as the popularity of weight loss injections and new drugs that work similarly to them make it onto the market and gain a lot more prominence and use. Ozempic face has been making the rounds a lot in the media, and I wanted to kind of dispel some of the hysteria and use some facts and some logic to tell you a little bit about what it is, what causes it, and how you can prevent it or treat it if you develop Ozempic face and Ozempic face aging. So before we delve into Ozempic face and treatments for that, just to start off with a quick overview of what Ozempic is and other similar weight loss injections. So Ozempic is the brand name for a drug called semaglutide, and semaglutide is a drug that was initially approved for people with type 2 diabetes. And it works by basically mimicking the hormone GLP-1, and so it stimulates the same receptors as that hormone, and that hormone has a few key roles. One of the reasons it was being used for diabetes is it affects insulin and glucagon, which are essential for regulating your blood sugar. As a happy kind of side effect, people who were using it for diabetes in the studies, they'd also found that they had a lot of weight loss, and that then led to the realization that actually Ozempic also mimics another of the actions of GLP-1, which is that it causes a couple of things. The biggest one related to weight loss is obviously the insulin and glucagon and the sugar regulation, but it also acts on other receptors in other bits of the body, namely the brain as well, to suppress the appetite, and it also delays digestion of food. And both these effects, alongside with its hormone effects, alongside with its blood sugar regulation effects, lead to reduced weight, and that can be quite a significant amount of weight, anything between 5 to 20% upwards reported. This depends on the starting weight of the individual, the semaglutide, the type they've had and how long they've been, but we're talking about a lot of weight loss. Whilst Ozempic isn't specifically approved for just weight loss, it can be used by doctors for weight loss purposes, and this is what has gotten a lot of attention around weight loss drugs. Ozempic, you could say, is the poster child for this. It's had a lot of popularity amongst some celebrities. Some have been open about using it, and public figures as well. Some haven't, but there's been press speculation, and that has led to it being a lot more it led to it having a very big profile, a big persona in the weight loss injections market. But it is by no means the only weight loss injection drug. There is also Wegovy, and that is also a semaglutide, and it works the same way as Ozempic, but it essentially has a higher concentration of the drug, if you want to think of it in simple terms, and so that can lead to more weight loss, and Wegovy has been specifically approved and licensed for its use just for weight loss on its own. So and then of course you have Saxenda, which is not a semaglutide, it's a liraglutide, but it works in a similar way to Ozempic and Wegovy. And Saxenda has also been licensed, approved just for weight loss. And when we talk about weight loss, the approval is generally for someone who is obese or extremely overweight with another medical condition. But again, it has been, we know, used for people who aren't obese, but people who want to lose weight. And maybe have tried other methods that haven't worked for them, and so on. I'm not going to go too deep into what weight loss injections are. I've written a detailed blog post and guide about it, which I've left below, but if you are interested, I'm more than happy to make a video about that. But let's get back to Ozempic face. So Ozempic face refers to an accelerated form of facial aging that happens after massive rapid weight loss. So the two main features of that are features related to the skin, and in the skin you get thinning of the skin. It becomes less pliable, less elastic, dry, dehydrated looking. You can even get breakouts and irritation as well. But that kind of skin aging then results in maybe crepiness, fine lines, wrinkles, and if you had these before, they may look worse. They may look more obvious than they were before. The same with folds and so on. On the second end of that, you also have loss of the fat pads, loss of fat, and that leads to shrinkage of the fat pads in the face. And the fat pads are really what give the face its nice kind of structure, its appearance. It holds up your face, and so if you think of it, the younger you are, your face is a little bit fatter. That's what gives that youthfulness, and as you get older, they shrink naturally anyway, and that's when you get hollowing, and you can end up also with then looseness of the skin because there isn't anything kind of stretching it out underneath, and so that's how you end up with jowls and sagging skin. Ozempic and other weight loss drugs can cause this. You can end up with quite a hollow, gaunt looking face, and then you may, on top of that, with the skin changes, have more lines, wrinkles, and skin sagging and thinner skin. And so really the overall effect is premature aging. It's looking much older. And that, I know that sounds terrible, but I wanted to dispel a couple of things. So firstly, Ozempic face does not just happen with Ozempic. It can happen with any of the weight loss drug injections, and it's been termed that just because Ozempic is the most famous of these drugs. So it swings and roundabouts. It gets all the publicity in terms of the good stuff, but it also gets the negative associations as well. The second thing is it's actually not just limited to weight loss injections. Any form of rapid weight loss can cause this. So I personally also seen a lot of this in patients who, for example, have a gastric bypass or a gastric band, where there is a lot of weight loss in a very short period of time, and they will end up with similar changes to this, and obviously loose skin in the body and so on. So Ozempic face is not just to do with Ozempic, and it's not even just to do with weight loss. It's really accelerated, fast weight loss. So the drugs are doing what they're supposed to do, but this is an unhappy side effect of that, because when you lose weight, whatever the method, you lose it all over the body. Sadly, you can't spot lose weight in certain areas. So that being said, what can you do about it? Well, there are three things. The first one is prevention, and the other two are to do with treatment. So prevention, if we said it's rapid, massive weight loss, then obviously the solution is a more gradual approach to weight loss. So in the first instance, that might actually be not to use weight loss injections if that's an option for you, and lifestyle modifications and something else like that might help. Then that might be something that your doctor advises you as a better outcome, particularly if you're someone with already a perhaps thin face, where these changes might look even more stark on you. If really the best option for weight loss for you is these weight loss injections, and it's important for you to lose weight quick. So for example, if you have a comorbidity and you need to lose a lot of weight quickly in order to kind of just be healthier and in better shape, or whatever, you have surgery coming up, something like that, then you and these injections are your best bet, then one of the other things you could do, if the weight loss can be reduced, the rate of it, so your doctor might opt to choose a drug that works a little bit slower than the others, or change the protocol. So again, that's something that you can discuss with them, and they can make that decision based on the evidence there is from the clinical data. And then the other two options are to do with treatment. So slowing down your weight loss isn't an option, then what can you do if you develop Ozempic face and Ozempic face aging? So remember, we said there are two things that happen. One is specifically to do with the skin, the other is to do with the face volume loss. Well, treatment should focus on those two things. So the two things that happen to the skin are that it basically prematurely ages. So you treat this as a skin aging problem. So we're going to be dealing with skin texture, we're going to be dealing with fine lines and wrinkles, and a lot of that, and dehydration, and a lot of that is caused by the loss of collagen and elastin. So good anti-aging skincare should include definitely a retinoid, and probably a prescription retinoid like tretinoin. That's going to help with smoothing out the texture, reducing the appearance of fine lines and wrinkles, and simulating the collagen, elastin, and blood vessel formation, so that the skin is it's thicker, it's plumper, it's more pliable, more elastic. And then finally addressing the issue of hydration with good serums and moisturizers, things like hyaluronic acid, glycerol, and polyglutamic acid will kind of bring water to the skin, and then you can seal it with a good moisturizer that contains things like ceramides and other natural occlusives. So those are the two big things you can do from a skin aging process, and these will improve the quality of the skin, they'll help tighten it, and they'll help it look better, and that may initially just give you a little bit of that boost of confidence that you need. The second part is addressing the underlying facial volume loss, and so really the only kind of non-surgical option for that is going to be things like hyaluronic acid dermal fillers. So what the dermal fillers will do is replace some of that missing volume, and so often it'll be dermal fillers in the mid-face, but it may also need dermal fillers in the lower face, and if there's any hollowing up around here in the temples, to restore the face volume loss by mimicking the natural fat pads in the face, but with dermal filler instead. And please remember, with dermal fillers, they should always be hyaluronic acid, because that's dissolvable, and it is temporary, and it's not going to ruin your face. And if there's a problem, you can just get rid of it with hyalase injections. And then finally, other treatments that you might want to consider, things like laser and Profilo or Volite skin boosting injections. So laser will have laser and chemical peels, for example, will exfoliate the skin, and so like the tretinoin, they will help smooth the external surface of the skin and make it look a bit better. Things like Profilo and other skin boosters will help tighten the skin and make it less crepey looking. And then finally, last but not least, microneedling and radiofrequency microneedling. Again, like skin boosters like Profilo, like tretinoin, they will help build collagen and elastin, and so improve the appearance of the overlying skin and reduce that premature aging look. And so those, I would say, are the main treatments for this. You may only require one. Often people require a combination, especially if there's loss of fat, loss of face volume and skin changes. And then which options are best for you will just depend on the extent of the premature skin aging, how much of an Ozempic face you have, and you can discuss this with a good dermatologist or aesthetic doctor who will be able to guide you on the best treatment for you. So I'm going to leave it there. I hope you found this video useful. I wanted to give an overview on what Ozempic face is, how to prevent and treat Ozempic face aging. If you have any questions, please leave a comment below. Don't forget to check out the link to our Ozempic and weight loss injections guide, and also there is a blog post I've written on Ozempic face aging. And if you have any questions, please either comment below, let me know if you would like me to do a video more widely on weight loss injections and how they work and the difference between the different types. Don't forget to like this video and subscribe to our page and hit the notification bell. Until next time, stay beautiful.